Welcome to Kidney Cancer Unfiltered. I'm your host, Anna Maria Scaccia. Today, I'm talking with Amy Plaizier, who is diagnosed with both kidney and thyroid cancer. Amy shares how she manages the symptoms and treatment side effects of two different cancers, the importance of a strong support system, and how her diagnosis has impacted her family. As some of you may know, Amy and I share similar cancer journeys, making this episode especially meaningful. I'm grateful for her friendship and guidance. She's a true example of resilience. This episode is a testament to the strength it takes to face multiple battles at once. So let's get started. Well, thank you, Amy, for joining us on Kidney Cancer Unfiltered. While we know each other well, why don't you introduce yourselves to the audience and tell them your story?
Hi, my name's Amy, and I'm in Utah. I'm located in Utah. I'm a mother of three, and about 2.5 years ago, it was incidentally found that I had a large kidney tumor. And as they were worried it had metastasized to my lungs, they ended up finding a thyroid nodule, which ended up being thyroid cancer. So within 10 days, I was diagnosed with two different cancers. And so I had my kidney removed in January, my thyroid removed in February of 2022, and just been managing both of those cancers since then. So that's it in a nutshell.
Yeah. Well, I wanted to say I was thinking about this. Like I'm grateful I'm talking to you today because it's actually a year to the day that I had my thyroid removed for cancer. And
Oh,
so
really?
yeah, so it I mean it's a cancerversary, so it just kind of it makes it feel special to chat with you today just because our story is
Yes.
so similar. So yeah, I mean I trying to figure out where to start here because there's so much I could ask you, but so much I already know. But I want to talk about the feeling of finding out that you have two different cancers. You had two different cancers like within 10 days of like of each other.
It was a blur. It was a whirlwind. Like the first one was completely like I didn't have any idea. And so that really threw me for a loop. And then I think I was in such a bad place, like mentally and emotionally, because I didn't really have a lot of answers about anything. Um, when they found the second one, that I couldn't even really process it, right? And it's interesting, even now, the kidney cancer that was so traumatic at the beginning and such a shock is still kind of traumatic for me a little bit. Like I have a lot of PTSD, I feel like, from that. And the thyroid cancer, I'm like, oh, I don't, what, it's whatever. But that's the one that's giving me the biggest
Yeah.
hassle. So I feel like I should be more worried about that one. But it was so overwhelming and crazy. And I'm like, does this really even happen? Like, I've never heard of anybody having two cancers at the same time ever. And so I'm glad I met you.
Yeah,
It's
I was
great.
gonna. I wanted to give the listeners, some context about how you and I know each other. So we were both on a focus group for kidney cancer and for treatment, and I had mentioned that I had both kidney cancer and thyroid cancer, and you're like, "Oh, really? So do I." And it was just, I think I know for me, not to speak for you, but I know it was like a shock to me because it's
uh,
like and then when we got to talking, we realized that we have almost the same exact profile in terms of like our
hmm
kidney cancer is chromophobe, our thyroid cancer is papillary. We both have the RAF positive. We both still are fighting cancer, thyroid
hmm
cancer. And I don't know, it's just, it was the same thing as like, I didn't hear of that before, right? Like, I know people could get
hmm
recurrences, but two different types of cancers that are concurrent was just weird. But then once
Yeah.
like I met you and like I went on sport groups, I feel like I've seen a lot of people or read a lot of people who made posts that say, yeah, I have kidney cancer too, if they're in the thyroid group, or if they're in the kidney cancer group, be like, oh, I'm also battling thyroid cancer. And it's just
hmm
like, what is happening here?
When you said that, I was like, no way. And then, yeah, we are living these parallel lives where it's like all the same sort of things that just keep happening. And so I'm really grateful for you. But yeah, I don't know. I have seen a lot of people granted, the ones that I've come across seem like there's been kind of a bigger gap between the kidney and the thyroid, or they're a lot older in age. And so, but it does happen. It is
Yeah.
happening, and I don't know what's going on.
Yeah, and I think I think I've seen that, and I've also seen where it's like they're battling at the same time. And the reason why, like, other than just wanting to talk to you and telling this story, but another reason why I want to talk to you, I think, or rather I know, one thing we talked about or had like doctors who kind of dismiss the possibility that they're connected. At least I know that that was something I continue to run into because there isn't necessarily research in this area, although there's research. There's one study that shows 4 concurrent cases of kidney and thyroid cancer.
Mm.
And there's other research that connects thyroid disease to kidney cancer and just like a really like just shows the interrelationship between the thyroid and kidney.
Mm-hmm.
And so I just wanted to talk about that experience, your experience, and kind of how maybe we can change um that reaction, if you will, right? Like that
Yeah.
I belief, I'm not sure what the right word is here, but that maybe that belief that these are not connected whatsoever. Because I feel like with everything I've seen, our conversation, our lived experiences, there's something to explore here. And that was just a ramble. So I don't know what your reaction.
Well, I do feel the same way because when I was sitting in the hospital after getting my kidney removed, I mentioned to my urologist, I said, I have this nodule in my thyroid and, kind of like, could it be cancer? And he's like, I guess it could be. It could be just really bad luck.
Oh
And
man.
every doctor I've ran into is just like, oh, it's just really bad luck. And even like I had this little genetic mutation of unknown significance, and they just reclassified it as benign. And so it doesn't mean anything genetically. So I'm like, okay, so everyone just keeps telling me I have bad luck, but I'm kind of more of a believer of root causes. And are we
Hmm.
really getting to the root of the issue of any sort of cancer, first of all? Or
Yeah.
second of all, something related like this where there are more people, and isn't the thyroid is more endocrine
Hmm.
and I think the kidney is too. And is it hormones, with the thyroid that's throwing everything out? Who knows? You
Yeah.
have to send me that study that you read because I haven't even read it. But essentially, I've just been told that I have bad luck. And I ran into this guy the other day. He's like, they say if I didn't have bad luck, I'd have no luck at all. And that's kind of what I feel like.
Yeah. Yeah.
Just bad luck after bad luck. But I don't feel like that's a sufficient answer either. I want to know why.
Yeah. But I agree. I got kind of the same thing. It's like, oh, it's bad luck. They're just it, or I got, well, we know that there's a increased rate, like an increased risk of these other cancers. You typically typically hormonal like that have an endocrine connection. But no, they're not connected. And I'm like, penicillin wasn't a thing before it was, before it was a thing, right? It's like if
Mm-hmm.
you have someone coming to you, which I said that in another episode. So anyone listening to that, yes, I like that saying. It's a thing. But I feel like if we have to people coming to you and saying, hey, this is an experience, I know of other experiences, I know that there's research out there at least that shows a connection, like, is there something to this? Like, I don't know, for me, having a doctor saying, well, we don't have the research right now, but maybe it's something to like just take the idea seriously, because I agree with you, I want to know
Mm-hmm.
why, and I don't think it's just bad luck is not a sufficient answer for that.
Yeah, that's an I don't know answer.
Yeah.
And I mean, to be honest, like since mine were found within, the same time period, I don't know which one started first. So
Hmm.
I don't know if kidney caused thyroid, thyroid caused kidney, or if it really is bad luck and just like my body wasn't functioning well. Anyway, and so that's hard. And where I don't even have like an oncologist or anything. So I'm just being managed by an endocrinologist, a urologist, and then a bazillion other doctors. But I'm like, I don't even know who I would talk to
Hmm.
or even give this information to because I know my doctors aren't doing research,
Yeah.
they're booked with patients all the time. So there is just kind of this breakdown of like, who do you even talk to who will listen?
Yeah, exactly. I 100% agree. and can relate to that. So I wanted to shifting away from like that bigger macro conversation about researching this. We had a conversation like one-on-one about just realizing that we're two-time cancer survivors. And you said something to me, I can't remember the exact saying, but it was just like sometimes it just hits you out of nowhere, like a punch in your gut. Like you're going about your day and then you're like, oh wow, I had cancer twice in such a short time. Now for me, like we
Mhm.
found it like maybe 2 years from the kidney cancer, but papillary, just like chromophobe, is quite slow growing. So you're right, like you have no idea which one's first. But it's still considered concurrent cancer. And I just wanted to talk more
Mhm.
about that, like I, I don't know, painting the picture for people who may not understand what it's like to have two different cancers, right? Like not necessarily having a recurrence, but having like two completely different cancers in a short period of time.
Yeah, it feels like two things are trying to kill you at once, and you're just trying to fight them off, you know? And I don't think we walk around thinking about our mortality and just being alive all the time, until you have something trying to kill you
Yeah.
actively and you're trying to fight it off constantly. And so when that does hit you, like, oh, you know what? Like, this is actually really, really serious business. And I have to do all of these things that I don't want to do and manage all of these things and go to all these appointments and scans and whatever that you don't want to do just to stay alive. It does kind of sucker punch you in the gut. Or, you know, the first cancer knocks you down and then you're finally starting to breathe a little bit, or you feel like, okay, I got through this. And then the second cancer comes along and knocks you back down, and you know
Yeah.
what you're in for. And you have to get back up and do everything all over again, or double everything all over
Yeah.
again. And it's really, I don't know if there's even really words. It's just this heaviness that you can feel inside,
Yeah.
of trying to live with that. There's no words that I can think of. And not to be a Debbie Downer, because there's some really
No.
beautiful things too, either. Also, like, there's beautiful life lessons and everything, and a different way of living, and really actually living when you're dealing with two cancers. But
Yeah.
it is heavy and hard to just get knocked down over and over and over. And it just feels like bad news over and over and
Yeah.
over.
Yeah. There's so many things I want to touch on from that one. I want to first talk about like where you are now. I know with I believe the kidney cancer, you're Ned, like you're clear, I believe. But with the thyroid cancer, I know you're still battling that. Can you talk more and
Mhm.
as much as you're comfortable of kind of where
Sure.
you are right now?
Yeah. Yeah. So the kidney cancer, yeah, is no evidence of disease. I did meet with my doctor yesterday because I had a little bit of a scare on my scan so
Oh,
I'm getting scanned every 6 months.
yeah.
And this time they ended up mentioning something on my liver. And I was like, but they said it was essentially unchanged from 2021. And I'm like, no one's ever mentioned anything about anything on my liver. And so, it's just these things that
Yeah.
is the roller coaster of it all. And my doctor's like, well, since it's unchanged, like, it's fine. I'm not worried about it. This is a great report. But I'm like, as a patient, this did not make me feel good.
No, no, it's
you
like,
know?
tell me what this is first. But go on. Yeah, yeah.
Yeah. And some radiologists just say things differently, but I'm like, from a patient perspective, you're stressing me out. But essentially, that's okay. My thyroid cancer, we were watching a lymph node for the last 2-ish years. And so I had a neck dissection in January, and they took out 30 plus lymph nodes on my right side, and 6 had metastases in them. So we're thinking, cool, we got it. But my numbers, like my tumor marker numbers, only went from a 1.9 to a 1. So they're essentially saying that I still have it somewhere. We don't know
Yeah.
where it is. They think it's probably moved to the left side, but there's nothing glaring right now. So
Mm,
just living with cancer, I guess,
yeah. Yeah.
unfortunately. But
Mm,
it's small enough where it's not becoming an issue. And my doctor has told me there's a lot of new treatments that are coming out for thyroid cancer, which was kind of exciting to me. So hopefully when I get to the stage of needing something further, then I'll have some more options.
Good. Yeah. Yeah, because I know we talked about them trying like developing things to address the being BRAF positive because it's for
Mhm.
listeners who may not be familiar with thyroid cancer or the BRAF mutation, when you're BRAF positive, you're less likely to respond to the treatment. Yeah, for me, I go in August to see where my tumor markers are. It went from like a point
Oh,
15 to a point 2. And so and so we're hoping that the radi like the RAI worked for between like April and August, but
yeah.
right now I'm just on a very high dose of Synthroid in order to like suppress any growth. And not to make this episode about me, but you get it, right? And I
Yeah.
wanted you to talk about so one thing I think often about is like survivorship, obviously, but like
Mhm.
survivorship care versus like actual treatment care and how there's so many things you have to manage in survivorship that is either often not recognized or or it's dismissed. I was telling a friend this morning, it's like I was finally getting back to myself before I got the thyroid cancer diagnosis, or feeling like I was somewhat back to myself, though still managing all like the stuff that comes with having one kidney. And I don't know about for you, but for me, like my energy still has not returned the way it was before I had my thyroid removed. Like it is just there, it's I'm at the space where I can still be very active, but like I have to pick and choose how I'm active. Before I could do like, you know, 2 hours of like lifting and then like an hour of intense cardio. And it's like now it's like all I could do is like walk and lift. And I don't even have the energy to pull out my like kickboxing bag just to put it on the screen.
Mhm.
If that like, how are you, I guess, managing both with kidney and thyroid? Like, how are you managing basically those side effects, if you will, of having cancer?
Yeah. Well, fingers crossed for you next month,
Thank
friend.
you. Thank
Hopefully
you.
everything goes well. Um, I feel like I finally, I mean, I'm 2.5 years in to this, and I feel like maybe this last time was the first time that we've settled in maybe on a dose.
Mm,
Like, especially when you have cancer that they're still trying to treat and suppress you, like every 6 to 7 weeks, they're messing with my medication.
mm,
And I don't know about you. And so it's like, okay, well, I just can't ever settle in to like feeling good because you're either so suppressed, which makes you feel crappy, or they're
mm.
messing with it, which then I'm up for at least like 2 nights trying to like re-regulate. My body temperature is off. I'm getting muscle cramps in my legs, my arms, wherever. And then my hormones are off. I'm like angry or sad or whatever. And so this last time, they actually switched me to a medication, which is like a name brand. So I had to fight my insurance for it, but it's more easily digested. And I'm actually feeling like really good for the first time in probably 2.5 years. So I'm excited about that, but it is hard to manage those symptoms. Like I took my kids to the pool yesterday for a few hours and I got home. I'm like, I just gotta lay down, you know, like I just need a minute because that constant use of energy where I'm like literally depending on medication to keep that
Mm-hmm.
energy, it can zap it really quickly.
Yeah.
And it, that's what's hard. And then sometimes I worry like, oh, if there's an emergency, like what if I can't get this medication? Like it's literally keeping me alive
Yeah.
or keeping me somewhat normal, or like I'm going on vacation, so now I'm trying to like figure out what medication I need and if I'll have enough to get me through, and it's just like a constant juggling act of trying to figure out what's going on and what I need.
Yeah. I wanted to talk about those symptoms and what you may be experiencing, I guess, within your kidney cancer survivorship. Like, are there things that is it more manageable, or is it just that with the thyroid cancer and the way the side effects are of the like treatment and whatnot, is more so consuming that you kind of have to focus. I'm not sure if I'm making sense, but it's like when you have these two different types of cancers that present in survivorship in different ways, it's like which one, like how do you manage both?
So I feel like the thyroid cancer is kind of more in my face because it is the one that is like still kind of active and being more aggressive. The kidney, though, like in the back of my head, I'm always trying to think, am I drinking enough water? Am I hydrated enough? What's my creatinine at? Like I want to get more into protein and how is that going to affect my kidney? And so, like, meeting with my doctor yesterday, we kind of went all over all of those things, but it's like every time there's a scan, they're doing contrast. So I have to be super well hydrated to do the contrast, and then I have to drink a ton to get the contrast out. And so there are certain things that I have to manage as far as the kidney goes, especially around scan time. And then just being like aware and making sure that I'm taking care of the one kidney now because I don't have a spare
Yeah.
anymore, And so I don't ever really think about it. But then sometimes I do. I'm laying there and I'm like, I only have one kidney now. That kind of sucks. Like
Yeah.
I don't have a spare anymore. And I really wish that I had two. And I mean, I went through a lot of therapy thinking in my mind, I had this big black hole there where that kidney
Hmm.
was. And now seeing the scans, like a bunch of organs have shifted over there, which gives you like these weird phantom pains or like
Yeah.
scar tissue, disturbs the scar tissue or whatever. But I mean, I think the thyroid is definitely more in my face right now, especially where it's like every 6, 7 weeks I'm rechecking numbers. And so it's just this continual battle with that one.
Yeah, no, that makes sense. And it's interesting that you bring up the black hole and then sometimes like thinking like, oh, I have one kidney because sometimes I'll get a pain in my left side and I'll like just have this automatic fear that it's cancer and like
Mm-hmm.
or like cancer in my kidney and then I have to remind myself it's like no, that was the kidney that had the cancer in the first place. That is not like you don't have to worry any well, you don't have to worry about that,
Yeah.
but it's just like this, I don't know, you sometimes forget like, oh, all right. Yeah, there's only one there. My spleen's taking space in the other.
Yeah.
Yeah.
I don't know if you ever get like pain in your right side now and you're like, oh
Yeah.
no, like that's my only good one.
Yeah. Oh my God. Anytime I feel any type of back pain, I'm just like, okay, let me
Hmm.
shift to make sure it's not flank pain. And if it goes away, then I
Yep.
know it's not. Is it constipation? Like, what is it? But
Yep.
anytime there's right like pain in my right side, or anytime like that's the thing. It's like either part. Like anytime there's like a pain here, or anytime there's a
Hmm.
pain there, or wherever, I'm just like, okay, I'm just
What's
feeling
going
it.
on?
Like, what's going on? What's happening? It's just,
Yep.
it's tough. Now, I want to shift from you and going to your support system. Because it's different. It's caregiving is important. But I think there's a different type of experience for caregivers when it's like two that you're kind of working with. So what was the experience with your support system and with your caregivers just trying to continuing to go through this journey?
Yeah. My husband has been a super good support. I think, when we found out about the kidney, we're like, okay, just get it removed and, go on our lives. And then it's like, wham, thyroid cancer too. And so, okay, start again, get through it again. And then as the journey has just kind of continued and continued and continued, that burden that he shoulders is still there. And so I have to fight a lot of guilty feelings, and trying to like push through when I really can't or shouldn't, just to try and take some of the burden off of him. I mean, because I feel like life with jobs and kids and life in general is hard enough. And then you add on all of these doctor's appointments and all of these surgeries, and then not even feeling well enough to function. It's
Hmm.
it's a really heavy burden that he's carried. And I'm so grateful for him. And he's done it fabulously without complaining. And I mean, he took off work to go with me to my doctor's appointment yesterday because I was worried about this liver thing that ended up being nothing. But
Yeah.
it's just all of he's on the roller coaster with me. And I know how hard the roller coaster is because
Yeah.
I'm there doing it. And then to drag someone along with you too
Yeah.
makes you feel bad. And
Yeah.
then they also feel helpless. And so I try and do a lot of things alone as to not make it harder on him too.
Yeah.
And it's just this constant juggling act and checking in with each other. How are we doing? What do you need? How are you feeling? What do you feel about this? And he's done fantastic. And I'm so grateful that I've had him, and I do
Yeah.
have great friends and great family who have been there also. So I'm really lucky and blessed as far as that goes. But it is hard to bring people along on that roller coaster.
Yeah, I completely relate, and it's hard to not feel guilty. Like I feel in
Mm-hmm.
relation to my partner, like I feel guilty putting him through that. And I think I'm the same way. Like I don't turn to him as much as I probably should because I don't
Mm-hmm.
want to be the burden I think I am when it comes to like my health and the way I feel
Right.
around my cancer. But I think I feel, and as a parent, I want to ask you this too, or at least get your insights. But I think I feel more guilty about doing it to my son because it's just,
Mm-hmm.
telling him the first time, right? Like that I had cancer was intense, and like he was going through his things about worrying about that I would die and all that stuff. And I think he finally got to a
Mm-hmm.
point where he was like, okay, I'm not afraid my mom's gonna die anymore. And then it's like, oh, I'm sorry, I have cancer again. And he's just like kind of spiraled back to the space of
Mm-hmm.
like, I don't want to be away from you because there was one time he was just following me room to room. And it's like, I would just go to the next room just to get something. And I'm like, I just asked him, I'm like, baby, why do you follow me room to room? He's like, I want to have as much time with you because I don't know if you're going to
Oh.
die. And it's like, oh my God, how do I not like, how can you not feel guilt? Even though it's not your fault, right? Like, it's not our fault that we
Yeah.
got cancer. It's not our fault that we got two cancers. But it's like when you're a parent, it's like, how can you not like feel
Yeah.
guilty that your health and your body is making your kid feel like, oh my God, I need to cling on as much as possible because I don't know what's gonna happen.
Yeah. Ew, there's a lot to unpack with the kids. Um, my son is like my middle child, and he's highly emotional, anxious child. And granted, like all of this went down during COVID too,
Yes,
where like
yeah.
everything was kind of uncertain anyway. And then I was talking to my therapist, and it was like as everybody's life started to normalize, mine just came crashing out from
Yes.
under them again. And so we've spent hours and hours in therapy with my kids too. And there's no way to describe like my 6 year old, she was 4 at the time. So she seemed like whatever. But now she's starting to cry almost every night. I don't want you to die, mommy. I don't want you to die. And you're trying to like explain to a 6 year old who doesn't really understand. And my oldest daughter seemed fine with everything, but then she started pulling her hair she ended up with a bald spot on her head.
Mhm.
She's pulled out all of her eyelashes, some of her eyebrows. So now we're in intense therapy trying to reverse all of that. And it's hard to think, was I the stressor that started all of this? And also with my son. And, the first time we didn't tell him that it was cancer. We just told him I had to go have surgery, have my kidney removed. And then once we found out it was cancer, we told him. And he's just jumping up and down. I can't believe it. My mom survived cancer. I can't believe it. You survived cancer. And then 10 days later to sit down and say, guess what? I have cancer again. And he just melted down, just blew up, melted down. Like, you know, why do you have to have cancer again? Why is there cancer? And to not only manage your emotions, but try and manage their emotions. And then there's this grief of like not having the life or being the mom that I wanted to be or have. And then, it used to be mom, 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 mom. And now lately I've noticed they're like, dad, dad, they that don't even ask for me as much anymore because I have been so absent trying to recover. I've had 8 surgeries in the last 2.5 years, just trying to recover from everything, and then radioactive iodine and all that stuff. You know, I just haven't been myself. And so
Yeah.
trying to manage their emotions, my emotions, it just adds more doctor's appointments,
Yeah.
but I do want to give them the tools and like the fighting chance to get through it, through the trauma that they might not even realize they've experienced.
Yeah. Have we talked about Camp Kesem
A
at
little
all?
bit, yes, we have.
Yeah. I don't know if they have one in like they have a chapter in Salt Lake. But I'd say like take having Kelly go to that camp it helps a lot. I mean, he's also in therapy too, so that's helping. But when he
Yeah,
didn't have a therapist, I think having access to that camp. So it's, I mean, not to say you have to put them in that, but it'd be something I would suggest looking into because they do also year-round events because I mean, it's just I can't imagine being in I don't know how to put this because I don't want to start crying. Because this is like one of those subjects where you're like, oh, I might just become a
it's
puddle
close to
right
the
now.
surface.
Yeah, it's like
Yeah,
I might become a
it's
puddle.
hard.
Yeah.
Yeah.
So I'll shift away, but I just wanted to say it's like I can't imagine what he's feeling, Like my older
Yeah.
sister had cancer and I understand like the fear of losing a loved
Hmm.
one, but when it's like your parent and you're not even like he's 9 now, so it was 6 when he
Yeah.
like sick, it's just I can't. But shifting away from a very hard subject, let's be
A
honest,
very heavy one.
it's a very heavy one. It's a very hard one. I I don't even know where to shift to, honestly. Like, how do you follow up that? I guess I wanted to go back to the top, talking about just the response to having two cancers and not finding the answers. In your opinion, like, what do you think? Because I personally, I really do think something's there, right? Like, I'm not a doctor, I'm not a scientist, I'm not a researcher, I can't figure it out. I was doing research on like the pathways that the thyroid and kidney shared, and there's a connection with iron, and then also polycystic ovary syndrome, and all this stuff. Um, but so for me, I'm trying to talk about it as much as possible, but I think I would love to get your opinion on like what else can we do to get doctors to take us seriously about like looking into this and at least hearing us out and being like, okay, why do you think it's connected?
I mean, I don't want to say I've given up, but I'm like, I know everything's become so specialized, like my urologist has no idea what my endocrinologist is doing. They don't talk to each other,
Yeah.
And so I'm like, I don't even know where to start. I mean, I've talked to geneticists and an oncologist, and essentially they just said, we're not smart enough to figure it out. Like, there might be something there, there probably is something there. We just don't have the information. And I guess I'm just holding out the hope that somehow as they start figuring out genes and everything, that they'll eventually get to the spot where they're like, oh yeah, now this makes sense. And this is why. um I mean, even if there were studies for us now, even being survivors, that would be fantastic to be able to say.
Did, like you said, kind of just surveyed or found a collection of people, like just put out there, like, hey, did you have kidney cancer and thyroid cancer at the same time? Right? Like,
Yeah,
who, like, let's talk about your cases, even if it's like a retrospective. I don't know. And maybe this is whoever's listening, maybe this is my like call to action for someone to reach out to us and be like, okay, I want to know your story. And we're going to talk about this. And we're going to do something. Because
hmm,
I don't know what caused my kidney cancer. Like, there's no genetic linkage, if you will. That's not the right word, but we did genetic testing and there's like nothing in my genes
yeah,
that would predispose me to cancer. Even though thyroid disease runs in my family, I've never been diagnosed with thyroid disease. Like I've never been diagnosed with hyper or hypo. So it's like there was nothing in that history. So it's like it's just when you don't have the answers, you want to do everything you can to find the answers, I think. I think that's the space
yeah,
I'm in right now.
yeah, absolutely. And I mean, there's 3 people, myself included, on my street with thyroid cancer, just on my street. And so I called like the state epidemiologist. I'm like, isn't this weird?
Yeah.
And they said they spent like 3 days researching it and everything in my area is trending the same that it always has. And so, no,
Mm.
but I'm like, I feel like it is weird,
Yeah.
like these incidences of cancer and like what could have caused it. And then, the three of us haven't lived here for an exceptionally long time. So we probably got it before we even moved here. But, I don't know. There is just some weird stuff going on. And I feel like, I don't know, maybe because there's not a lot of money in it that
Yeah.
nobody really cares, you know? And that's hard, that's sad to say, but I mean, especially young people with kidney cancer is so rare.
Hmm.
Two cancers is even more rare. It's like, oh, it's not worth it to even look into. And that's a hard thing to feel. Like,
Yeah.
you don't care? Like, this is my whole life. Like, this is a big deal to me.
Yeah.
And I don't know. I don't know how to get people to listen, but I'm happy to jump on board with you.
Yeah. I mean,
Make
just
some noise.
right. I think doing this podcast is making some noise, and hopefully it piques someone's interest, or at least answers, right? Like instead of just well,
Hmm.
they're just not connected, or well, because you had kidney cancer, there's a higher chance you might get another cancer. And here are the cancers. Like, okay, why is there a higher chance? Like, can I have those answers? Um, but
Yeah. And I
yeah,
think, oh, sorry. Yeah. I think when you
yeah.
answer those questions, though, then you can figure out how to prevent it. Because for me, I'm like, okay, I've had kidney and thyroid. What else is coming? When's the next shoe going to drop? But if you could tell me, well, this is
Hmm.
why, then I know what I got to do to not have it happen again or
Yeah.
recur or whatever. And that's what's frustrating is you're just like shooting arrows in the dark, hoping
Yeah.
something sticks and that it doesn't come back.
Yeah, pretty much. Now what yeah, I feel like that is just our have been our entire lives for the last three years.
Hmm.
Yeah.
Yeah, for
What
sure.
advice would you have for survivors like us, right? Maybe it's not kidney and thyroid, maybe it's kidney and breast or kidney and something else, but what advice would you have for someone who's going through two different cancers, in terms of like managing both their treatment and survivorship?
I think one of the things that I've learned the most is to just have a lot of grace with yourself, to give yourself the excuse to sit down and rest when you don't feel good. Don't try and push through things because it doesn't make things any better. It makes them worse. Do what you can, ask for the help when you need it, and just that you're stronger than like you will learn some really beautiful things about yourself and where you've come from, and you'll make really lasting relationships and deeper relationships with people around you as you go through, and to look for those bright spots because that's the only way it gives purpose to like the hell that you're living in.
Yeah, that's one thing I think I appreciate so much about you, other than having like this connection. Not that I want to have this connection with someone because I don't want to have this story, right? Like you don't
Right.
but I'm grateful that I have this connection with you because I think like your focus on giving yourself grace and like your focus on being gentle with yourself is something that I know I struggle
Mm-hmm.
with. So when I like see your Instagram and talk to you and we have these conversations, I end up feeling better. Like when we were having the conversation about, sometimes just and randomly thinking that you have cancer and feeling like it's a gut punch. It's like, oh, that's exactly what it is. I didn't have those words for that. And then like you gave me those words. So I really appreciate you for that. I think or rather, I know you've done a lot for me more than I could probably express.
Oh, you're so sweet. Thank you. I mean, I'm a recovering perfectionist and been known to be really hard on myself. And so that's been a really hard lesson, but it's made me slow down. It's made me appreciate the little things again, have almost a childlike wonder about the world again, and to really, I mean, when I found out I had cancer in December 2021, I thought that might be my last Christmas, and I spent, because I didn't have any answers at that point, I spent that Christmas wondering who was going to mother my children and thinking that might be my last Christmas. And it does make you really notice things
Mm.
again and really appreciate things. And every day really is a gift. And And as you get further into the journey, I feel like I've started to forget that again and kind of just
Hmm.
go back to my old self, my own patterns, my old ways. And and then I do try and have to stop and be like, you know what? Like you're in the midst of things on kind of account. Everyone's on a counting clock, like
Yeah.
you don't know how much time you have left, and we don't think about it. But sometimes it is good to think about it because it does give you a different appreciation for your family, your friends, and just the beauty of life that you still get to be living it, that you still
Yeah.
get a chance to wake up another day.
Yeah, it's funny you say that because when I was diagnosed with thyroid cancer, I was doing the same thing where it's like I started to kind of slip back into who I was before kidney cancer in terms of like
Mm-hmm.
overworking myself and all that stuff. And then I got the diagnosis and I'm like, okay, well played, universe. Like
Yeah.
you could have told me to slow down a different way. Like this didn't have to be it, but thanks. So,
No, I
well,
feel the same way. I'm like, what
yeah.
lesson haven't I learned yet?
Yeah. It's like, what's the next one gonna be? Like, can you give me a head start here? Like, it's just, but hey, if we didn't have bad luck, we would have no luck. So there's,
No luck at all.
that's no luck at all. So I guess that's that we should comfort us. Well, thank you so much for joining me on this episode and sharing your
Absolutely.
story. Again, I'm grateful. I know I keep saying grateful, but like I'm grateful I got to talk to you today of all days because it's one I'm trying to, it's as a friend put it, it's a grieving process, right? And you continue to
Yeah. It's
grieve
it's a
and
good day, but a bad day.
yeah,
So happy
exactly.
cancerversary.
Yeah, thank you. Yeah, it's weird. Some things that you like, I don't know. We need things, right? Like we need these things to just make ourselves feel slightly better, maybe. I don't know.
I hope you go get some cake or a balloon or something. And I mean, you made it 1 year without a thyroid. That is an accomplishment.
Yeah, yeah, that is. I would say that is an accomplishment.